Hi, my name is Baum. I'm the founder and CEO of vitaTrackr. vitaTrackr is all about data, moving data in healthcare. As physicians, you're probably quite familiar with the push to move health data and possibly the frustration in moving it as well. As a matter of fact, you may know the analogy of why is it I can use an ATM card anywhere in the world, but when I go to a physician's office, I'm just as likely to still see a clipboard. Well, vitaTrackr believes it's built on the premise that the challenge of moving data in healthcare has nothing to do with technology or even standards. It's a market issue, or in this case, the lack of a market that's impeding the use of health data. So vitaTrackr is a marketplace. It's a health data marketplace that connects data sources that create data with destinations that use data. It intermediates consumer consent where necessary to connect or transfer that data, and provides a financial settlement for the transaction of passing data from source to destination. Moving data is all that we do. We don't create data, we don't use data, we don't analyze data. We don't compete with any of the participants in the vitaTrackr marketplace. We encourage them to develop those products, services, and applications. Our motto is don't compete on access to data, compete on the value that you add to data. So what's even more unique is that the positioning of vitaTrackr is as an industry utility. We serve the entire industry, but we don't benefit or disproportionately advantage any individual sector or entity. So if vitaTrackr sounds familiar, think Visa. Visa is not a bank. They don't even issue credit cards, yet they do manage a network that includes 2.2 billion cardholders around the world, 36 million merchants, 15,000 financial institutions, and processes about 13,000 transactions per second. So it is a model that scales. It is a business model that works quite efficiently, and it has been proven and time-tested. What vitaTrackr has done is taken the Visa model and applied it to healthcare. In healthcare, the participants in the transaction always include three parties. One, the consumer, upon which all data is created, a data source, which creates that data, and the destination that uses the data. So these three participants then become the basis of the vitaTrackr marketplace network. vitaTrackr uses what's commonly referred to as the network effect. Each additional participant in the network or marketplace adds exponential value to everyone else in the marketplace. So what happens very quickly is that a decision not to participate in the marketplace becomes a business limiting decision. And that is the force that drives the transfer of data and the transformation of the industry. Right now, vitaTrackr is signing on strategic partners to its marketplace. We have connectivity to just about 20 million points in the network. As we reach critical mass, we will bring the marketplace, we'll turn the marketplace live and begin transactions between sources and destinations. A few days ago, AngelMD began following us on Twitter. So we reached out, and the more we learned about AngelMD, it became obvious that vitaTrackr is a very good fit, given your focus. And so we thought we'd introduce ourselves to you, tell you a little bit about what we're doing, invite you to look at our website, and certainly to invest in what will be the future of healthcare. One thing about these network effect business models is that they move very, very quickly. Facebook, Twitter, eBay are all examples. I would say that within 5 years, when you look back at vitaTrackr, you'll say a health data marketplace. How did I possibly miss that? So thanks for your time. We invite any questions that you may have and look forward to creating the future of healthcare with you.